Do you leave every doctor's appointment with more prescriptions and referrals and also more questions? Oh, friend, you're in the right place. I'm Kayla, registered nurse and personal medical strategist, and here every week we're going to work together to cut through the noise, connect the dots, and finally get you the real plan you deserve. Let's dive in. Hi, welcome back to Scripts and Referrals. I don't know where you are, but today here on the Eastern Shore, I am soaking up this weather. It is, I think we have like a high of 86 today, and as I'm recording this, it's September 19th. So I'm pretty sure this is like our last good day of summer. And I joke that I am part lizard, because I'm sitting here in my office and it's 79 degrees and my hands are cold. So I hope that you're getting to enjoy the last few bits of summer as well. Um, Today, I want to start off with a story. I, you may or may not know, part of my background is as an ICU nurse for several years. And one time I admitted this patient. He was critically ill. He was on life support. He was on a ventilator, so had a tube in his mouth down into his lungs to do breathing for him, along with a whole other host of medications to keep him alive. And the really crazy part is that all of his blood work that they had done in the ER prior to admitting him, every single value was normal. Like there was not a piece of red on the screen at all. Everything was completely within normal range. And honestly, that was a huge like aha moment to me, because a lot of us, maybe even your doctor, kind of fall into this trap of thinking that if the labs are normal, then the patient must be fine, right? But here was this man in front of me who was definitely not fine, and all of his labs, all of his numbers were perfectly normal. Now, obviously, that's not the norm, but it is enough of a reminder that we can't afford to take normal labs at face value. So let's break this down. Normal does not mean that nothing is wrong. However, that is often the implication. What it actually means is that the specific things that were tested for came back within range. That's it. When a provider orders blood work, um, it can depend, but usually things start off with a CBC, which stands for complete blood count, and a BMP, which is a basic metabolic panel. And they're great starting points, right? Like the complete blood count breaks down your white blood cells, your red blood cells, platelets, and make sure that they're all in the right categories. The CMP, complete metabolic panel, tests your electrolytes and your kidney function. Valuable information. But this doesn't say anything about a whole host of other things that could be going on with your body, like hormones, autoimmune process, or other inflammatory markers. So instead of hearing everything looks good, I want you to reframe that, because what you should actually hear is we've ruled out a few things. That is useful information. It tells us where not to look anymore and it narrows the search. But here's where things get tricky. Too often, normal test results get twisted into something bigger. This idea that because your labs came back normal, or even CAT scan, X-ray, you can substitute there, but the testing came back normal, you must be fine. Or even worse, what that often blooms into is maybe it's anxiety. Maybe it's all in your head. And sometimes that's unintentional. Um, I know I've talked about it before, but doctors are rushed and under pressure. And oftentimes they glance at the labs and assume things are improving, especially if this is how it went. if you had an appointment for a problem, then had tests done, then have a follow-up appointment, your doctor is not thinking about you in between those appointments for the most part. So oftentimes when they get those normal test results back, they have a tendency to conclude that, oh, something must have improved by the time they got the blood work done, and that's why we're seeing everything normal. And a lot of times they can fall into this trap of automatically thinking that normal tests mean improvement in the condition, or at worst, that nothing is wrong. But sometimes it is intentional. Some providers lean on normal test results and really connect that to everything being fine. And sometimes we'll even tell you that because it gets you out of their office and it saves them from having to dig in any deeper. But either way, the impact is the same where you start doubting yourself. So, first and foremost, you have to protect your mindset. A normal lab or test imaging, whatever, does not erase your symptoms. It does not erase your lived experience. It just means it's one piece of the puzzle that didn't give us the answer. You have to hold that line. So, what do you actually do in this situation? All right, we're going to get real tactical today. So, my first step in a situation like that, um, especially if you were told to wait and see, is to put a finish line on that. We don't want that to go on indefinitely. So say something along the lines of, if this hasn't improved in 4 weeks, what's our next step? That small change can stop that endless limbo because it forces a plan. Number two, I recommend you use curiosity-based language. If we think back to some of the previous episodes where we talked about the overwhelming importance of communication, how you phrase things really matters. Instead of saying that didn't work, try something like, since these labs were normal, but I'm still having symptoms, what's the next step in figuring out the cause? Or can you help me understand how these results fit into the bigger picture? Or even more simply, can you walk me through your thinking here? This keeps the provider in the expert role, but requires them to connect the dots for you. And it's collaborative instead of combative. Um, when that, sometimes you'll still have a difficult provider, though. We've talked about it before. Unfortunately, there are some who can be rather ego driven and don't want to deal with you sometimes. So, in a situation like that, know how to escalate your case, but do so selectively. If you genuinely believe that your safety is at risk, ask to speak with a nurse manager, a medical director, or the patient safety officer. But please only save this for true red flags. It's a safeguard. It should not be a go-to move because it can kind of blow things up with your provider. Um, it's a challenging situation, right? Because on the one hand, you need somebody to take care of you, but you also need them. You need them to hear you, and that leads me to step 4 here. This one's tricky. Know when to move on. Please take this as your explicit permission to fire your doctor and hire another one. And believe me, I know that that is easier said than done. But some people don't even realize that it's an option, or feel like they have to wait for something really dramatic to happen before they feel justified in making the switch. Please don't. Your health is important. And if you have a provider that you feel is routinely dismissing you, not willing to be collaborative, even when you've, put these communication techniques into place, those are significant red flags. At the end of the day, this is somebody who you are literally trusting your life and your health with. They need to be motivated in helping you get to the outcome that you're trying to get to. And it can be challenging, right? Because there's insurance networks to consider. Sometimes the provider that you need is out of access. I get it. Like I actually live in a rather rural area, and there's sometimes where we might only have one of those specialists in 150 miles, and travel is a real barrier. But I want you to make sure when you're thinking about this that you're weighing the costs and not just the cost of the out-of-pocket copay or the cost of travel to see that provider, but what is the cost of doing nothing and staying with the person that you're with now? A dismissive provider could miss something serious, even life-threatening. And when you think about it like that, sometimes those switching costs are not as high as they seem to be. So here's the bottom line. Normal test results are not the end of the story. They are just one piece of the puzzle, and they certainly do not mean that nothing is wrong with you. It just means that the very narrow set of things that we were looking for are not the causative agents here. Some doctors forget to explain that, and some even rely on you believing that normal does mean that you're fine. Guys, that's medical gaslighting, and it's not okay. Don't fall into that. But your job is not to have to try to figure it out all yourself. Your job is to notice, to name, and to act on it. So reframe the results, use the right language, and keep pressing for the next step until you do get answers. And if you can't do that alone, that's where someone like me comes in. If you want a hand in figuring out your next move, I do offer free consults where we'll talk through what's been happening and identify the smartest place to focus first. It's not a full plan, but even in 20 minutes, we can cut through the noise and point you towards a better next step. If that sounds useful, go over to heardforlife.com/free and book a call because you deserve clarity, not platitudes, and you deserve someone who can help you see what others miss and a plan, not a pat on the head or maybe it's anxiety. So thanks for listening. If this was helpful, I would love if you would share it with somebody. It means a lot to me to get this kind of information in the hands of everyone who needs it. And of course, subscribe so you don't miss any future episodes. And I will see you next week. Go enjoy what is left of summer. I'll talk to you soon. Bye-bye. Don't you go to another appointment unprepared. Head on over to heardforlife.com/guide and get my free doctor's appointment prep guide so you can start getting the answers you need and get off the medical merry-go-round. I'll see you next week.